Well, hello. Good morning, good afternoon, good evening if you're listening to this later. My name is Jody Scholes. I am your instructor for the MBLEX review course. Got a full house here today. And wanted to welcome you. Today we're going to be talking about the benefits and physiological effects of massage. It is going to be 15 questions on your MBLEX, and we're going to look at the different systems of the body. We've got a lot of systems and a lot of benefits to get through. And my goal here today is that by the time you finish this class, that you'll be able to, in your own words, you'll be able to talk about the benefits of massage. So that you'll be able to restate the benefits of massage in your own way. But class today is in 3 parts. I like to give you some test-taking strategies in the beginning of class. Then we'll go into our learning. And at the end of class, we've got some fun questions to dissect, to practice when you take the MBLEX, And these will be questions that we will work through. We'll dissect what they're asking. We'll look at the answers, look at all the answers, and then we'll pick the best answer. And that is really the strategy, in fact. So today we are talking about the benefits and physiological effects of massage. And welcome back. Welcome back. Very happy to have you here. All right. So today we're going to be talking about test-taking stamina and the importance of test-taking stamina. So I'd like to give you some test-taking strategies at the beginning of this lesson, because what you know, the knowledge that you have, the things that you have learned are not going to be enough to have you pass this test. I wish I could say that just your knowledge is going to be enough, but it's not. We have to have a strategy. Many of you have already taken the MBLEX once and were not successful. We call that failing forward. And it stinks. It sucks, actually. And I'm sorry that the test is so hard. It is a hard test. However, one of the ways that you can prepare, well, by taking this class, obviously, but also is to build your test-taking stamina. Now, what do I mean by that? Here you see a runner. If you were going to go and run a mile, say we all meet at the local high school and we're going to go 4 times around the track. We're going to go run. How's that going to feel? If I said, right now, let's go. I'm going to meet you at your high school, or you're at the school nearest you, and we're going to go run a mile. You'd be like, no, I think I need some time to get ready for that. Yeah, okay, so that would feel like, oh, shoot, man, I hope I'm in shape enough to do that, right? But what if I told you that in a month from now, I'm going to meet you at the track and we're going to run a mile? You would have some time to get ready, right? You could build your stamina. You could build up to it. You could go maybe running a mile around the track is usually 4 times. So maybe you would start by running 1 time around the track. Maybe you would get up to 3 times around the track. Maybe you would get, up to the point where maybe you wanted to run long. So let's go ahead and give me just 1 minute. Trying to find out whose microphone is on because it's echoing. Do check your mics. Thanks. All right. So back to our example about the track. So maybe you'd even get up to running like 6 times around the track, right? So that 4 times wouldn't feel so hard. That's called building stamina. And that's what we're doing with practice exams. That's what we're doing by taking a full practice exam. So you're building your test-taking stamina. You're building your ability to focus. Now, there are 2 ways to tackle a practice exam. 1 is as meaningful homework. 2 is the option 2 is to, sorry, people are joining in here. I'll start over. So there's 2 ways to tackle that practice exam. 1, you're doing meaningful homework. 2, and if you don't feel like you're doing meaningful homework, hit me up in the patrons, message me, and we'll talk about how to do meaningful homework. But one way you can do that is by taking practice exams, right? And the other way is by simulating the MBLEX. So 2 different ways to tackle a practice exam: meaningful homework, simulation exam. Let's talk about meaningful homework. If you're taking a practice exam and you're doing it as meaningful homework, like homework that is smart homework, homework that actually has some type of benefit and you're not just spinning your wheels. If you're taking a practice exam as meaningful homework, if you get stuck on a question, you can Google it. You can actually open a new window and try and figure out the answer. If you're completely stuck, you have up to 4 hours to finish the practice exam. Now, some of you have fallen asleep or started it one day, tried to pick it up and take it the next. You can do that, but here's the challenge. It doesn't automatically grade. It times out after 4 hours. You can finish the test, but it won't automatically grade. You're going to have to get in touch with me. I will manually grade it, and then you'll have your score. So that's meaningful homework. If you're going through the exam, you know you're going to take up to 4 hours, and you're just going to sit there and you're going to get through it. And please, the idea of taking those practice exams is that you have shut the door, you have turned off your phone or flipped it over, and you're building your stamina. So part of the learning, yes, part of it is learning, but part of it is sitting still for a couple hours. Yeah, to build your stamina. So that's one way to take the practice exam. The other way to take the practice exam is to simulate the MBLEX. If you have a test date, it is time. If you're within 30 days of taking your MBLEX, it is time to switch gears and simulate the MBLEX. That means you're going to sit down, you're going to have an hour and 50 minutes, you're not going to have any help, no books, no Google, no looking anything up. You're going to go straight through and you're going to pretend you're taking the MBLEX. You're simulating your experience with the MBLEX. If you have distractions at home, consider going to the library. Consider taking your laptop or using a laptop at the library in a quiet spot. You can even get a separate room at the library if you reserve it. Sometimes they'll just let you have it if you ask. You can simulate the MBLEX. That again is building your test-taking stamina. And that is my test-taking strategy for you today, is to understand that to be successful with the MBLEX, you will need to build your test-taking stamina. All right, you ready to get started on some learning? You ready? Time for learning. We've got a lot today. All right, we're going to start with the 2 different types of the benefits of massage. Then we're going to move through the systems of the body. Remember to breathe. So we're going to start off by talking about the mechanical effects of massage. This is compared to the reflexive, mechanical and reflexive. Mechanical effects is something that is physical, something that I have physically done to alter a change. So I have rubbed, compressed, manipulated, I have stretched a muscle. So if I have physically changed that muscle, that is a mechanical effect. The warmth of my hands has softened the tissue. Mechanical effects compared to the reflexive effects of massage. And that is something that the body does on its own, reducing the heart rate, reducing the blood pressure. I don't physically reduce your blood pressure when you get a massage. Your body does that. So if the body does it itself, That is a reflexive effect of massage. If I have done cross fiber friction and released scar tissue, released fascia, stretched a muscle, pulled, that's a mechanical effect. I just want you to be aware of the two different kinds. Every now and then on the MBLEX, you'll be asked about the reflexive effects or which of these is a mechanical effect of massage. In fact, if you are a patron at the $49 a month level, you have the full-length classes. I go over this quite in detail during the full-length lectures. And then you have a subject matter specific quiz that asks you questions about this. All right, let's move on. Here are our systems of the body. These are the systems that we're going to be covering today. We're going to go through them. Got a lot of slides. I got over 100 slides today, so let's just get into it. All right, we're starting with the nervous system because that's really important. This is like how massage really works. It balances the nervous system. So the nervous system is, the anatomy of our nervous system is the brain, the spinal cord, and the hundreds and hundreds of miles of nerves that run through our body. Yes. So the nervous system responds to stimulus. There's action potentials that are sent along neurons. If you're hearing words like neurology, neurons, we're talking about the nervous system. This is how the nervous system works. It responds to stimulus. So, and touch is one of those stimulus. So there are two parts of the nervous system that I want to talk about today. We want to talk about the central nervous system and then the peripheral nervous system and the benefits of massage to the nervous system. So in the central nervous system, you have the brain and the spinal cord. It is the central, it's like Grand Central Station where all the trains go. You got tons of train tracks, tons of railroads out there, but Grand Central Station, central nervous system, consists of that brain and spinal cord. And it coordinates all of our nervous system. So the peripheral nervous system, as you may have guessed, is all those areas of the hundreds of miles of nerve endings and nerve pathways in our body that stream out through our extremities, through our thorax, the front of the body, and through our legs. That is the peripheral nervous system. So we've got the central nervous system over there. We've also got the peripheral nervous system. As a part of the peripheral nervous system, we have the somatic and the autonomic nervous system. Let's look at the autonomic. So if you have a car that's a standard, you have a gear shift. If you have a car that's an automatic, then the car shifts on its own. We're going to look at the autonomic nervous system, things that happen on its own, things that reflexive effect of massage that we were talking about earlier. In that autonomic nervous system is housed the sympathetic and the parasympathetic nervous system. This should look a little familiar. Remember to breathe. Remember to breathe. This is a review. All right. So peripheral nervous system, somatic, autonomic, sympathetic, parasympathetic. Let's take a look at the sympathetic body system responses. So sympathetic responses are the fight or flight. So here's what happens to our body organs during a fight or flight response. So this is when our adrenal glands kick in. We sense danger. Ooh, am I going to fight or am I going to flight? So the pupils dilate because we're watching for predators, right? All of a sudden our eyes are wide open. And things start to, some systems calm down, some systems kick in. So for example, our heart rate goes up. Okay, danger, danger. So digestion is going to slow down because we don't have time to digest right now. We're going to slow down digestion. Our adrenal glands kick in. So that norepinephrine and epinephrine are secreted. Adrenaline is secreted. We might have to run for a long way to outrun the saber-toothed tiger, right? Let's now move to the opposite, the parasympathetic response. Parasympathetic response is also called the rest and digest. So this is safety, peace, we're chilling. What happens to our body during the parasympathetic response, the rest and digest? This is the response we're going for during massage. So some things increase, some things decrease. So for example, our heart rate slows down, all is well. Our blood pressure decreases. The bronchial muscles slow, they contract and expand, but the breathing slows down. So our breath slows down, but the absorption goes up. So digestion, we can absorb the food. We can actually, when our stomach just calms down, that's motility increases. That means that it's easier to go to the bathroom. Motility is a way of saying going to the bathroom. And it just, things calm down during the rest and digest phase of the massage. This is, again, part of the autonomic nervous system and the benefits of massage to that system. So rest and digest are really what we're going for during the massage. Now, let's go ahead and look at the endocrine system. So what is involved with, what organs are a part of the endocrine system? We've got our adrenal glands, we've got the testes in a male, we've got the ovaries in the female, we've got our pancreas is involved, the thymus, the thyroid gland, of course, and then in the brain, we've got the hypothalamus, pituitary, and pineal. This is the components of the endocrine system. The endocrine system produces hormones that regulate many different bodily functions. So what are the benefits of massage to the endocrine system? So hormones travel through the bloodstream or through the interstitial fluids, the intercellular fluids, and then hormones will increase or decrease activity of where it's going. So here's those listed, the components of the endocrine system. You can see them here on the slide. All right, so the benefits of massage: reduces anxiety, promotes relaxation, decreases beta wave activity. So if you, beta waves are basically that I heard someone say like helmet fire. If you feel like I call it monkey brain. If you feel like, oh, there's so much going on in my brain, massage will help to calm that down. Alpha wave activity. So alpha is non-arousal. So that calming effect. So the endocrine system releases hormones that help to just reduce that anxiety and promote relaxation during the massage and after the massage, actually. And of course, it would make sense, I'm sure, that massage increases delta wave activity, meaning that's what you have in the deep sleep cycles. So if you have a client who's having trouble sleeping, you may want to consider inviting them to have their massage towards the end of the day. That relaxation response will carry over and it will help a person that same night to sleep more deeply and for longer. A benefit of massage. Dopamine levels will go up. So that's the dopamine. Actually, I think of the dwarf, Dopey. It's like just kind of like, hi, I'm Dopey. If you're Dopey happy, Dopey was always happy, always had a big grin on his face, right? So it increases dopamine levels. which is a good thing. That gives us our overall feeling of well-being. Increases serotonin levels. Again, we need serotonin in our system, and it reduces that chemical called cortisol, which is produced in stressful situations. Cortisol is evidence that that we've been under stress. We have cortisol in our system. So it reduces and helps to eliminate, to get rid of cortisol in our system. And again, balances off these hormones. That's really what you want to know about the endocrine system. Can reduce feelings of depression. Again, depression is very serious. So depending on how your client is dealing with depression or how you are dealing with depression, massage can be a benefit to help reduce those feelings. But depression is something that definitely needs attention from a mental health counselor, a licensed clinical social worker, a psychotherapist, a psychiatrist. If you know someone, if you have a client who's dealing with feelings of depression, it's good to get expert help on that. Massage can be a part of that treatment plan because it will help to regulate the hormones if those hormones are involved with the feelings of depression. Improve sleep. Yeah, all right, good. Leaving the endocrine system, we're now going to the muscular system. Yay, the one we always think of when it comes to massage therapy, right? When we talk to people about the benefits of massage, say for the nervous system, or the skeletal system. We'll be talking about that. They're like, oh, isn't massage just good for the muscular system? It's good for all the systems of the body. But let's review the benefits to the muscular system. So obviously it relieves tension and it relaxes the muscles. So massage reduces the excitability of the muscle by calming down the nervous system. So it calms down that fight or flight response by increasing the rest and digest response. So it can help with relieving muscle soreness, because one of the mechanical benefits of massage is to help to eliminate waste, metabolic waste in the muscle tissue. So it increases the amount of metabolic waste that's being eliminated. Muscle soreness, technically, is metabolic waste. I know, who knew? Now, sports massage therapists will talk to you about sports massage therapists will talk to you about lactic acid. And lactic acid is just one of the metabolic wastes that occur in the body. We've got carbon dioxide, we've got uric acid, we have all sorts of different metabolic waste that's being eliminated from the body on a regular basis. And so massage helps to increase the efficiency of your body in eliminating metabolic waste. So obviously we address trigger points as well in the muscular system. You know, I think we all go through a stage. I know we all go through a stage in our massage career that I call the seek and destroy phase. And that is when you can seek out the trigger point and you want to destroy it. Lay off the trigger points, okay? Treat them, but you don't have to spend 5-10 minutes on one trigger point. That actually will increase the excitability of that trigger point and make it more sore. Now, eventually, will it maybe unwind? Sure. But just do your part. Address it, maybe for a minute, then leave it. If you feel drawn to come back to it, come back to it, but check in with your client, because what we want to do is reduce that trigger point. We do want to see it unwind, but the release of the trigger point is a reflexive effect of massage. You did not go in there and break up that trigger point. That body is holding on for a reason. Something in that nervous system is holding on to that trigger point. And so by addressing it, coming back to it later if you need to, you'll treat that trigger point more appropriately. So we also addressed, any stuck fascia, any scar tissue. We'll see that in a minute. It separates the muscle fibers. It actually can improve the performance of an athlete. Absolutely, hands down. Lots of research has been done about improving performance, and that's by keeping those muscles healthy. It helps with balance, it helps with posture, it increases the flexibility, it improves overall performance. It can lengthen those muscles. It can help even with non-athletic folks, like say senior citizens who don't do a lot of moving. So it can improve the tone by improving the circulation. So these work hand in hand. The muscular system, the cardiovascular system, the nervous system, all of those combine to form different benefits of massage. All right, this is talking about how the pain cycle is interrupted. A lovely, lovely benefit of massage is literally to reduce pain. So the pain cycle is initiated when there's painful stimulus, and then there's a contraction and a guarding of the muscle. Once we initiate the relaxation response, that reflex contraction, that localized guarding of the muscle will actually release. So yes, we are physically manipulating the muscles. Yes, we are warming the tissue. But that pain starts to go away when that calming effect starts to help to relax the muscle. More about the pain cycle. So we relieve muscle spasms, yes. We improve circulation, yes. And we've talked about the more rapid disposal of waste products through the circulatory system, through the urinary system, through the respiratory system. Again, all combining to demonstrate the benefits of massage. And I mentioned scar tissue. This is a picture of a scar, a keloid scar. And massage therapy can help reduce the formation, and even if you've got one, can help to mobilize that scar tissue. Here's an example of an Achilles tendon scar. And deep massage helps to, again, mobilize and reduce excessive scar tissue by decreasing the adhesions. So it's to decrease that scar tissue and decreases the adhesions. You can see where this these indentations are. That's an example of an adhesion in a scar tissue. All of these being benefits of massage. All right, the integumentary system. So that is not only the skin, the hair, the nails. Let's walk through the anatomy of the integumentary system. So it's comprised of your skin. It is our largest organ. And it includes all of those things just below the skin too. Our sweat glands, sebaceous glands, hair, nails, hooves, feathers, scales if you're a lizard. Okay. So the top layer is the epidermis. That's up here. That's what we can see, the epidermis. Then we've got the next layer, the dermis, and then the hypodermis, sometimes also called the subcutis. So like subcutaneous fat, subcutis. So I'm going to, for the purposes of this lecture, I'm going to go with hypodermis. But hypo, right? Low, hyper, high, hypo, low. Sub, what do subs do? So sub or hypodermis is the lowest layer of the skin tissue. So let's see what happens at each layer of the skin. So the skin's role is to protect the body from outside stuff like mud, bacteria. It also keeps, it repels water. The skin is our protective casing. It also minimizes the loss of water that we drink. It protects the underlying structures like blood vessels and some of our organs. The skeletal system, for the purposes of your MBLEX, the skeletal system is really what protects our organs. Just saying. All right, the dermis. Next layer. So this is the layer of more thermoregulation. It helps with some of those sensations that we feel. Let's see, fibroblasts, yes. If you see any of these words, fibroblasts, histocytes, mast cells, adipocytes, these are all part of the integumentary system. You don't need to know what they do. You just need to be familiar with the names. You can see a little bit more of the anatomy here. This is the level of our dermis, and we're about to look at the hypodermis. Hypodermis. All right, this is where our insulation is. It's also that cushion. It's where our fat lives. So the hypodermis, like the subcutaneous fat, that is where that's actually providing us some cushion, and especially around our organs. So hypodermis gives us our smooth contour. It is where the fascia lives. So we talk about the skin, and underneath our skin is the fascia, and then is the muscle tissue, sometimes an organ. Fascia also surrounds our organs. It helps them to glide. But under the skin, under the hypodermis, is where the fascia lives. So again, this is also a part of thermal regulation. In fact, layer 3, this third layer, is really where the thermal regulation happens. That second layer helps to thermal regulations because that's where our sweat glands live and where our sebaceous glands live. So it gets rid of heat, but in layer 3 is where we keep our heat. And so if you're asked about thermoregulation on the MBLEX, hypodermis. All right, let's take a look at the benefits of massage to the skin. So by friction, we can warm up the skin tissue. We improve the skin's condition. How? By stimulating those oil glands. So this is the hair follicle. This is the sebaceous gland. That's our oil glands. So our sweat glands are different. See? Oil, sweat. So we improve the skin's condition because we stimulate those sebaceous glands, which actually helps to moisturize the skin with oil. It also exfoliates the skin. Eesh, do you know that fact about dust? Do you already know what dust is? Most of the dust in a home or office is skin. It's dead skin cells. You, right? But massage helps to improve the quality of skin by helping to eliminate some of those dead skin cells. So we flake them off. And it can help to increase the elasticity of skin, especially during pregnancy when the skin needs to stretch. Oh, and this is a lovely picture that I wanted to share with you. In Indian culture, postpartum massage is done for 40 days, sometimes longer, sometimes shorter, but on average for 40 days after the baby is born. Postpartum massage is done on the mama, and it's to help regain the elasticity of the tissue. Yeah, pretty cool, huh? That's part of Indian culture. All right, breathe. Breathe. We have a few more systems to go through. All right, ready? We're about 2/3 of the way through our slides. So breathe. Oh, and we're talking about the respiratory system, so really breathe. All right. What is the biology? What is the anatomy of the respiratory system? Take a look. Nostrils, pharynx, larynx, trachea. This, in front of this, is the esophagus. We'll look at the digestive system in just a moment, but the esophagus is part of the digestive system. The pharynx and larynx and trachea, where we breathe, those are all parts of the respiratory system. Of course, we have the lungs and the bronchial tubes and all that. All right, so let's pay attention to these words. Reduces respiration rate. That means it slows down the rate of breathing. So see how that's a little tricky? Reduces the respiration rate, strengthens respiratory muscles because we're breathing deeper, and that takes more muscle. Have you ever had a respiratory illness or known of someone, and when they went to the doctor, they had to blow into a machine to see to measure their respiratory rate or their capacity? Yes, because that's testing your respiratory muscles to see if they're strong again. Now, it decreases asthma attacks. It can increase the fluid discharge, so the phlegm that comes out of the lungs. And massage through its reflexive effects, because none of this stuff we're doing physically. We're not getting in there and massaging the lungs, right? So this is a reflexive effect. It's a nervous system effect, but it can play a significant role in the quality of pulmonary function. So it'll reduce the rate of breathing, strengthen those respiratory muscles, and improve the overall function, pulmonary function. So pulmonary refers to lungs. If you see that, it's about airways and lungs, pulmonary function. All right, let's take a quick break and ask a question. What part of our nervous system is responsible for the relaxation response? All right, where's our chat? Hey, you can put that in the chat. Ooh, I like it. I like it. I like it. I see some answers coming in. Which part of our nervous system is responsible for the relaxation response? I'm going to wait till we get, yep. All right. Very good. Yes. Oh, look at y'all. All right. Letitia, yes. Myra Renee, yes. Bobby, yes. Tanya, yes. Tanya, sorry. Tanya. Sandra, yes. Parasympathetic. Lana, yep. Good. Nuyo, yes. Trish, yes. Exactly. It is the parasympathetic nervous system response. Remember in other lectures and maybe even in your classroom, we've talked about if you were paralyzed, all you'd be able to do is rest and digest. I feel sympathetic for people who are always in a sympathetic nervous system response. See the cheetah? See the cheetah chasing the gazelle? Yeah, and then we got our cool frog. All right. Moving along, we've got a few more systems to cover. Let's talk about the digestive system. This is where we see the esophagus. All right, so our digestive system actually starts in our mouth, teeth, tongue, salivary glands, a little bit of high HCl, hydrochloric acid, that is in our mouth that starts when we chew, starts to digest our food. We swallow it down the esophagus, and then we've got a whole host of organs here in the digestive system. So our esophagus leads to our stomach. Once our stomach digests, it then goes off into our small intestines, large intestines. The liver is throwing out some bile to help us digest some fat. The gallbladder is throwing out, actually the gallbladder processes fat. Pancreas throws out some digestive enzymes. These are all parts of the digestive system. So, what are the benefits of massage to the digestive system? Well, it promotes the evacuation of the colon, meaning helps you poop. It relieves constipation. Constipation sometimes is caused by a overly active colon or intestines. Overly active, overly constricted. So by that rest and digest can help to promote that evacuation and relieve constipation. It also helps to uh, um, relieve colic and gas. Sometimes after a massage, people will feel gassy. That's because their colon is relaxing. Their intestines are relaxing. They're feeling good. So massage also increases absorption. So our body's ability to absorb the nutrients from the food. And that is the digestive system. Let's go on and talk about the skeletal system. Ooh, we got a comment. I think of paradise. Aha, Sandra says for the parasympathetic nervous system, she thinks of paradise. I like that. We're in paradise when our parasympathetic nervous system is kicking in. All right, on to the skeletal system. Here's are the components of the skeletal system. We've got two parts of that skeletal system, the appendicular skeleton and the the skull and the and the vertebrae, the axis, I think it's called. It's slipping my mind right now. So it's probably in the slide here coming up. All right. So what are the benefits of massage to the skeletal system? The axial, there it is, guy. Axial skeletal system. Again, these are just vocab words I want you to be familiar with in case you see it on the MBLEX. The axial skeleton is the cranium and the vertebral column. And then the appendicular skeleton are the extremities. So included in the axial skeleton is the ribs. But let's look at the benefits of massage to the skeletal system. It's like, what in the world could it be doing for the skeletal system? All right. Increases range of motion by working together with the muscular system. Massage can increase the range of motion, A, by softening and loosening and lengthening the muscles, but B, wait for it. Oh, here we go. Axial and appendicular. All right. Increases range of motion also because we're going to talk about synovial fluid in just a moment. All right. The axial skeleton and the appendicular skeleton. I think these slides were out of order. Sorry. All right. So you see what's included in that. The pelvic girdle is actually a part of the appendicular skeleton. So massage therapy will help promote fracture healing by bringing in more nutrients to the bone where it's healing. And you see the wishbone here on the turkey. The caption says, it should heal itself in a few weeks, but just for fun, do you want to make a wish? A turkey has broken their wishbone. All right, improves muscular balance and thereby skeletal alignment. So again, looking at that range of motion, with the muscular system combined, it improves skeletal alignment, improves posture. And joints are nourished by a joint fluid that was just mentioned moments ago. But we stimulate the activity of this fluid and it benefits the skeletal system. Do you remember? What is that joint fluid called? Yes, Lana, it is. It's called synovial fluid. And synovial fluid is in some of our joints. They're in a lot of our joints. We think of it a lot in the knees, but synovial fluid also lubricates the shoulder. It doesn't have to be just a ball and socket. It can be a hinge joint as well. There are a number of different synovial joints, but synovial joints are different. It's talking about that fluid in the joint. And there's 6 other types of joints. We're not going to talk about them today, but you heard me mention a ball and socket, the shoulder, the hip, a hinge joint. We're not going to talk about all the different types of joints today, but synovial joints indicate there's synovial fluid. And one of the benefits of massage is we stimulate the synovial fluid activity, meaning that our body produces this synovial fluid. And by working around that knee, we can actually improve the activity of that synovial fluid. That's why joints feel better after a massage. Because just like when you're like, oh, people say, get out and walk, you'll feel better. Well, you're moving, right? Yeah. Well, we help, as massage therapists, we help things move in the body. One of those things is synovial fluid. All right. Moving to, we're in the home stretch now, the urinary system. Both male and female have urinary systems. Males have the testes, women have the ovaries, that's the reproductive system. Urinary system is, or called the excretory system. Yeah. So the bladder, kidneys, ureter, or urethra. All right. So in the urinary system, we actually increase the amount of urine output. So part of the urinary system to the kidneys, the bladder. Yeah. So just a urinary system, excretory system. So it increases urine output. It promotes the excretion of nitrogen, inorganic phosphorus, sodium chloride in the urine. So that's why urine is salty, because it's got sodium chloride in there. It's one of the things we're getting rid of in our body. One of those waste products, one of those waste materials that we talked about earlier. All of those, nitrogen, inorganic phosphorus, those are all examples of waste material that are being eliminated through the urinary system. Oh, all right. So we're going to move into the cardiovascular system, and that's kind of big, but let's go through it. So this is a review. I'm not going to go deep on this, but the circulatory system or the cardiovascular system could be named either way on your MBLEX. So what does it do? Circulates the blood. It moves all of the nutrients into the different organs of our body. It carries oxygen to the body, carries carbon dioxide out from the body. It moves some of the hormones, and there's a lot of different things the cardiovascular system does. It does all of that, and it also helps with thermoregulation. Yeah, so that's the cardiovascular system, what it does. So what are the benefits of massage to the cardiovascular system? Dilates, opens up the blood vessels. So it improves circulation by dilating, helps to dilate. Now, do we go in there and actually dilate a blood vessel? No, we do not. No. Dilation is an autonomic body response to our rest and digest. It's a reflexive response. Now, are we helping to move waste? Are we helping to move edema? Yes, that is a mechanical effect. But dilating of the blood vessels, so it opens that up, it helps to promote circulation through larger dilating, so small, dilating. So when your eyes dilate, your pupils get really big, right? Same with the blood vessels. So that's how it improves circulation. It'll decrease our blood pressure. Sometimes we'll create hyperemia. Hyperemia. In the chat. Tell me what it is. Yes, thank you, Trish, for chiming in on synovial. Hyperemia. Tell me, describe to me in your own words, what is hyperemia? No looking it up. Okay, but it creates hyperemia. And we'll continue on with our benefits here. It feeds the tissue, feeds cells by bringing those nutrients into the tissue. Helps to promote the removal of waste products. Again, see the overlapping here? Yeah. It reduces ischemia. I will tell you, ischemia is an area of the body that is blood deficient. So it had a reduced blood level. So if it's ischemic, there's not a lot of blood in that area. Inflammation of the blood to the skin. Yes, I wouldn't standard use the word necessary inflammation, but we got our hyperemia answer. Our hyperemia is when a tissue turns pink. Yeah, it's not necessarily inflammation, but it is blood rushing back, fresh blood rushing back into that tissue, and it gets nice and pink. Ooh, let's see. Yes. So it's a lot of blood. It's excess blood. Yeah. Hyper, right? Hyper up, hypo. But hyperemia is actually a benefit of massage. And so have you ever like worked on someone's trap and all of a sudden it's nice and pink? Or you're working their rhomboids. Oh yeah, and it turns nice and pink down the middle of their back. That is evidence of fresh blood flooding into that tissue, oxygenating that tissue, benefiting those organs. Yeah, you're creating the hyperemia. So now let me say that a different way, because some people think hyperemia is a mechanical effect. It is not. You did not reach in there to that body, pull out some blood, and put it in a different part of the body. No. You warmed the tissue, which dilated the blood vessels, which brought the hyperemia. Reflexive effect. Yes, Trish says sometimes the client becomes itchy. Yes, it is. Because it's like, oh, wait a minute, we haven't had blood in that area for a while. Yeah, it's actually a good thing. It's a good thing. All right, let's continue on because we're closing in on the end of our class. All right, heart rate. It reduces our heart rate. And it reduces the heart rate, so it reduces the pulse rate. Stroke volume in this case just means how much blood is being produced, is being stroked out of the heart. Increases the red blood cell count. Yep. Increases oxygen saturation. Yes. Increases white blood count. Yes. So by improving the circulation, we improve the production of red blood cells and white blood cells. Now, this isn't like when someone is sick and they have a high white blood cell count. This is just the availability of white blood cells to fight infection. Fun fact, the average adult has about 5 to 6 quarts of blood, and blood is made up of plasma, red and white blood cells, and platelets. So red blood cells carry the oxygen to the body, white blood cells fight infection, and just so that you know, the red, when we see red in our diagram here, the red represents oxygen going out to the body. The blue represents deoxygenated blood going back to the lungs, going back to the heart and lungs to be infused with oxygen again, to dump off the carbon dioxide and to take back. It's going to give you a carbon dioxide molecule. It's going to take an oxygen molecule and then back out into the body. All right. The lymphatic system, let's just take a look at what it is. So the lymphatic system sometimes is also called the immune system. So our white blood cells do fight infection, but the lymphatic system is a key system that promotes our immune system, our ability to fight infection. So how does massage benefit the lymph system? Well, it promotes the lymph circulation. What's that? Do you know what the massage? There's a very specific massage technique that has to do with the lymph system. You can put it in the chat if you know what it is. I'll tell you before we leave this slide. Okay, massage also increases the lymphocyte counts, so it helps in the production of lymph. So lymphocytes are the blue, and the invader is the yellow. So massage helps to improve the production, the lymphocyte count. And so that lymphocyte count will actually, it's like, it improves the efficiency. So lymphocytes are there in the blue, and it's attacking a cancer cell there in the yellow. Oop, I see the answers coming in. Lymphatic drainage, yes. And what is the actual name? It has 3 letters. I'm going to put it in the chat. See if you can get it. Put it in the chat. We'll tell you in a minute. All right. So it increases the number of natural killer cells in our immune system as well. So CD4, CD4/8. Not that you need to know any of that, honestly, but just to understand how massage benefits our lymph system to enhance our functioning of that immune system. And they're really one and the same, the lymph immune. Yeah. All right. Ah, yay! Okay, yay. Yep, helps with edema. It definitely helps with edema, but it's called the very special training. Am I spelling that right? The very special training if you're dealing with people who have lymphedema, if we're dealing with the lymph system, and you want to get trained on that specifically, it's called manual lymph drainage. And that is a mechanical benefit of massage to mechanically get in there and move the lymph. Yeah, it's pretty cool. It's a very light touch, by the way, as well. You would think originally when I was exposed to it, thought it was going to be really deep, and it's not. It's really light, really light touch, but very helpful. All right, let's dissect a few questions and get you on the road. What is a benefit of massage to the skeletal system? A question was asked before we answer this question. Question is asked, dry brushing also helps? Absolutely, dry brushing helps. If you're not familiar with dry brushing, either Google it or ask me in the Patreon account, and I'm happy. Dry brushing before a shower every day, highly recommended for everybody. It just really helps to promote skin health and movement of lymph. It's pretty cool. All right, back to the question at hand. What is a benefit of massage to the skeletal system? All right, let's see. Ooh, I put 1, 2, 3, 4. Oh, goodness gracious. All right, yeah. Oh, look. All right. Sandra chiming in. Nuyo, yes. Lana, Pumla, Bobby, Nuyo, Tanya Maria. Ooh, I'm just gonna call you Rico. Sorry. Yeah. But yes. But let's take a look. Maintains posture and body balance, reduces muscular tension, decreases flow of nutrients to the bones, promotes elimination of waste matter. Now, we know I like to eliminate one wrong answer, right? So we know it doesn't decrease the flow of nutrients to the bones. It increases, right, the flow of nutrients to the bones. But here's the tricky part of this question. These are all benefits of massage. Why'd y'all pick number 1? You're right. It is. Because each of these, number 2 and number 4, are benefits of massage to other systems of the body. So dissecting a question is not just about finding the true answer. It's about being sharp, about being wise, about being cautious about what they're actually asking. I'm telling you right now, you will have questions on your MBLEX that have 4 right answers. You, my lovelies, get to pick the best answer. Trust your gut. Go with your first answer. Next question. What system of the body are we talking about when we say sedates or stimulates, depending on the pacing and the techniques used? And by balancing this system, massage affects all systems of the body. So what system are we talking about? Let's see. Sedates or stimulates, depending on sedates or stimulates. Okay. Let's try and eliminate one wrong answer. Can we sedate the integumentary system? The integumentary system is the skin. We might be able to stimulate the skin, but if we sedate the skin, let's get rid of that as a wrong answer. All right, I see some answers coming in. 1, 3, or 4. I don't know what I was thinking today. 1, 3, and 4. Usually A, B, C, D. Yes. All right, let's take a look. Sandra, yes. Ooh, Rico. Best answer, babe. Best answer. Pumla, Nuyo. Yes, Bobby. Trish, and you and Rico. Maybe study buddies. Maria. All right. So by balancing the system, we have to look for the best answer, right? So what is that response that we're going for all the time with massage? We're going for that rest and digest, right? So I can see why some of you thought it was number 2. But the best answer here is actually number 4. Yeah, number 4, because we want that reflexive effect, not just on the digestive tract, although that's really important. It affects the nutrients, it affects the health of the body, but that rest and digest, the nervous system, we're looking for that parasympathetic nervous system response. And we can sedate or stimulate, right? You're right. Number 2 looked like a good answer, but number 4 is the best answer. What does the epidermis do? A, protects from bacteria. B, minimizes the loss of water. C, protects underlying structures such as blood vessels, nerves, and organs. D, all of the above. E, none of the above. Let's see. We get to read through, Maria, read through all of those answers. Because we want so much to find the right answer. It's human nature. Yes, that's the right answer. That is what the epidermis does. Okay, well, so we know the epidermis definitely does some of this stuff, so we can eliminate E, none of the above. Take a look, A, B, C, or D. Oh, we got some. Nuyo, Tanya, Sandra, yes, Lana, yes, Pumla, yes, Maria, you're in, right? Okay, yes, it's all of the above. So we minimize the loss of water, but we also can sweat, so it helps with thermoregulation. But yes, and it does protect those underlying structures, even though, reminder, and we'll look at the picture, yeah, remember? So the skin minimizes the loss of water, protects and remember, if you get a question about protection of organs on the test, most likely it's going to be skeletal system, but it could be the skin, just saying. All right. One of the general benefits of massage is A, increases touch aversion and touch sensitivity. I'm not going to read them. You read them. You read them because you're going to be reading your questions during the MBLEX. And you can put right in the chat A, B, C, or D, or just decide, you can say it to yourself. You don't have to put it in the chat. So general benefits of massage. Here's the tricky part of this, you guys. I'm going to show you something. Ready? Well, look at those words. Be careful. All right. I see any answers? Oh, you're all just saying it out loud. Okay. Okay. Thank you. Thank you. Let's see. Let's see what you think. All right. So we're divided here. We're divided. Take a look. So increases touch aversion and touch sensitivity. Increases academic performance. Decreases mental alertness. Does not affect a client's emotional needs. Sorry, guys. You ready? Letter B is the best answer. So one of the general benefits of massage is it doesn't increase touch sensitivity. It doesn't increase if I'm aversion, like if I have touch aversion, what does that mean? Ooh, if I'm averse, if I have touch aversion, it means, ooh, I don't want to be touched. If I have touch sensitivity, don't touch me. Will massage increase that or decrease that? Tricky, right? I know. I hear some of you going, bitch. Yes. No, it would decrease our touch aversion, right? Decrease touch sensitivity. It's tricky. I know. Because, like, look, and also, we're picking increased academic performance out of the blue? It actually does. Massage helps to increase academic performance, again, because of the rest and digest effect. That rest and digest, that parasympathetic, that relaxation response lasts sometimes 2 or 3 days. It can really help people to focus, to do better on tests. So it can increase academic performance. I know, out of the blue, right? Yeah. And I believe that was our last question. Yes. It's wrapped. Woo-hoo, yay, way to go. Nice. Yes, good
Yes.
job. Good job today. You participated, you learned. This is a really big deal. Do not make the mistake of thinking you get the benefits of massage. Okay, thank you, Neo. Um, don't make that mistake. We just had a graduate fail forward and got low on benefits of massage. I will shake you by the shoulders if you get low on benefits of massage. No, 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 never, never, never. Come on. And I want you to be able to articulate these benefits of massage as well. Yeah, my name is Jody Scholes. I am your instructor for the MBLEX review course. We meet every Thursday, 12 o'clock Eastern, so same time as New York, Boston, Miami. Um, so we're right here on Thursdays doing live class. They get posted later in the patron account. Thank you guys so much for being here. I'm going to hang out for a little while and take some questions, but make it a great day.